Researchers working on fighting childhood cancer have a new weapon, with a lab in southeast Melbourne becoming a global hub for their work. The Hudson Institute contains what's thought to be the world's largest collection of high-risk paediatric cancer cell lines, which are vital for developing treatments and, hopefully, even cures.
Yeah, the team there is led by Professor Ron Firestein, who joins us now. Thank you, Ron, along with Rebecca Goldstein, whose family donated tissue from her late son who'd been battling a rare brain cancer. I'm so sorry for your loss, Rebecca, but I'm glad that you are here, able to talk to us about it. I might start with Ron, if you don't mind, and come back to you. Ron, the significance of this being a global hub, what does it mean?
Well, the sad reality is really that over 400,000 children across the world every year are diagnosed with cancer. And in particular, for some types of cancer, like brain cancer, this is really a death sentence, a dismal outcome. The drug companies, they don't really invest in developing drugs specifically for children. So what we've done at the Hudson Institute is partner with the Children's Cancer Foundation to create the largest program in the world that's specifically designed to find new cures for children's tumors.
Tell us about the cancer cell lines and how you're hoping to use those in your quest to treat cancer and one day hopefully cure cancer.
Sure. So what we do is we've formed an alliance with 35 different institutes and hospitals in 10 different countries, including US, UK, Germany, Singapore, obviously here in Melbourne, Australia. And all these sites, they send us the patient tumor sample. And we take that sample, we grow it in the laboratory at the Hudson Institute in Clayton, and then we analyze the activity of tens of thousands of different drugs and genetic targets to find what works. And I think what's really exciting is that now we can use very sophisticated artificial intelligence tools, looking at hundreds of patients coming in from across the world to really predict which drug works for specific kinds of children's cancer.
Sounds fabulous.
Rebecca, could you tell me a little bit about Gideon, your son, and how you ended up becoming involved here?
Yeah, Gideon was 8 when he was diagnosed with a brain tumour. He was funny and quirky and had a great sense of humour. And very quickly we were plunged into a cancer treatment, and he had surgery and radiotherapy and targeted chemotherapy, and managed to have some time at school and have lots of fun family time. But his health deteriorated, and almost a year after diagnosis he died. And it's important for me to continue Gideon's legacy, but also to try and improve the outcomes for other kids who are diagnosed with brain tumours and other rare tumours. So being able to contribute to something that might help their outcome is, promising.
And how important are those donations from Rebecca's family to your cause?
Critical, absolutely critical. So one of the things we're doing and that we're very excited about is we've put all this data from the patients online in a publicly available portal, and that's accessible to patients, clinicians, researchers, and the idea here is crowdsourcing. Because pediatric cancer, it's a global issue that we need to deal with as a community. This is about having as many people, the best and the brightest across the world, working on this problem and giving hope to finding better treatments, opening new clinical trials so that children in the future won't have to deal with this devastating disease.
And Rebecca, if Gideon's legacy is one day, hopefully, more effective treatment of cancer, and one day even possibly that mystical cure, how would that make you feel as a parent?
I think proud and hopeful that other people have a better outcome than we have. Yeah.
Well, to both of you, thank you so much for coming in. It's certainly a momentous day with this news being released. I'm sure it's going to have ramifications right around the world as well. So thank you.
Thank you.
Thanks, Ron. Thank you, Rebecca.
Rebecca.
Thank you. Okay, let's go to finance news now. Over to you, Madeline.
Thanks, Michael.